So we'll give that to them. I like all the active cameras today. Yay! So for those of you who have not been on one of our chamber chats yet, welcome. What I usually do is run you through what we're working on or hearing here at the chamber, but honestly, half of the time it's just passed through, like, here you go, here you go, here you go. So what I'm gonna do before we head into Carol, because it also gives more people time to get logged in here, I'm gonna share my screen and move this little window over. So what you have is the email that just went out. I was just saying to Carol, I did an interview at 2:50, 10 minutes ago with Channel 8. And essentially, I said kudos to the county health department because a lot of counties have put orders in place. We've been saying all along, what are the metrics that we need to open? We've seen what the counties put out in terms of meeting 2 of the 4 metrics. We understand that, but many of the businesses have said, can we just see what a dial looks like? So we got a light switch, not a dial, but here is what I believe in my heart, that there are businesses out there that have read all of the guidelines, that know what they should be doing, and those are going to be ready to open. This also isn't going to be a light switch, or a light switch in terms of everything opening. So we have restaurants that the suppliers were not ready for this. So getting the food that they need to make what they need to make is going to be challenging. Again, no one ramped up for this because it happened quite unexpectedly and quickly. So the piece that is the newest, this morning I talked to Robin Moses at Downtown Main Street. We have been talking about a different partnership, but this community confidence that the business community is looking out for their best interest is really critical. And I've said this to countless businesses of, just because you open doesn't mean that people are going to be streaming through your door. It was very apparent on the Facebook page for the county health department. There's a large section of the community that does not believe businesses should be open. And so now we as businesses really need to prove that we can balance livelihoods and lives, those of our employees and of our customers. And so Downtown Main Street and the chamber said, well, why don't we start to have businesses take a pledge? So the businesses, by clicking on that link, it takes them to a form that says, please read through the county's business toolkit, please read through the state's business toolkit, and pledge that you're going to do what you can to ensure that your employees and customers are safe as you open up your business. And then we will be promoting those businesses that take that pledge. That's part of our business image, if you will, that we can really be in partnership with protecting the public. Because again, if we don't get that consumer confidence back up, the businesses won't thrive. They won't bring people off of unemployment and back into jobs. And that's not in any of our best interests. So I sent out a framework for reopening, which is, we just as businesses have to do the right thing. We do have our chamber toolkit that is out there. And then there's a couple of things, and then there's the other chamber stuff like wage surveys and honor student banquets and some other news. So I'm going to touch on this one really briefly. The Supreme Court decision is actually quite interesting because it has long-term impact. And what that means is the ruling said you can't have one individual or one arm of government making such a significant decision without another arm of government involved, being in this case the legislature. And so that has changed how government works and how other orders would get put in place. The other thing that is interesting is it said you really have to limit these orders to the scope of the department making the order. And so this is the piece, honestly, that makes me a little nervous because it could be abused, which is to say that the county health didn't have, or not county, I apologize, state health did not have the ability to tell healthy people to stay home, to not travel, determining who's essential, non-essential, and particularly it's the enforcement piece of it. which and Carol's probably in the background going, "Oh, you're making my hair stand up." But this is what I heard. Doesn't mean that this is 100% accurate. But we had heard from law enforcement saying we're not going to be enforcing this order. And what we heard as part of the Supreme Court decision was there's no law out there. You can't be ticketed as a healthy person for leaving your home under how the order is written. You can't be ticketed as a business because you are non-essential. And so again, this is what was interpretation of the Supreme Court case. We have to prepare for, let's just say, a second wave and how that process happens. And so really the Supreme Court decision is about saying, how do we want future processes to work? And if there is going to be an enforcement component, we've got to get prepared for that. And so that's the big long-winded piece of why the Supreme Court decision has other implications moving forward. So a couple of housekeeping things. I stopped sharing, did that. So the next thing is, if you haven't been in the chamber chat, haven't been in Zoom, which I would trade places with you quickly if you've never been in a Zoom meeting, because I get a million of them. So down at the bottom is a chat bubble, and you can type in your questions there. We have a large group on with us, about 73. So using that chat option there to ask your questions would be significant. So what's the number one thing that I hear today is, okay, we can open. What's the plan? What are the guidelines? What are the rules? And I thought that the document that the county health department put out was great from a public perspective, but it's always great to see the business perspective. And if you haven't seen that document that they put out, that is a business toolkit, that is a really great guideline. So with that, Carol, what message do you want to send from the county health department, and what are the questions that you're getting?
Thank you for inviting me today. I appreciate this opportunity to come and be able to talk to business operators right up front. I do want to express that we did not put out an order, and we do want to make sure that everybody knows just because you can open doesn't mean that you need to open. It's one of those, we're asking people to just kind of take a step back, look through all the guidance documents for opening and reopening. We have the toolkit that we've put out there that we can share with people. It's on our website. And then the state WEDC put together a bunch of documents, and they utilized the industry experts to really put those together, and they were really thoughtful about that. And those are the two things that we're recommending to everybody. And then just some of our key messaging is, and you heard Jen, if you were able to tune in for Jen at 11 o'clock today, she talked about staying home if you're sick. You know, there's still things that need to be in place. This disease, just because the order got overturned, the disease didn't go away. So we still need people to know that we're taking a look at that data. And so the first and foremost is, if you're sick or if your employees are sick, and you'll see that's a piece of our toolkit, having sick employee guidelines. You know, if someone is sick, what are you going to do? And sometimes that might mean closing down again for another day because whoever you had coming into work is showing signs of COVID, and we don't want to perpetuate that out in the community. We want to make sure that people are still minimizing that close physical contact outside of their home. So within your store, think about how people get in and out of your store. Is there a way to minimize that places where people would be contacting another person from outside of their household? Is there a way to do, you know, one way in and one way out, those types of things? I realize with some stores, there's just the one door going into the store. So how do we minimize that contact between people? Talking to your employees about minimizing travel outside of the area. While we're, you know, slowly reopening up things, there are some places that are still viral hotspots. And if you have employees that are traveling to those areas and then coming back to La Crosse, you know, they have the potential to bring that disease back with them. So we would ask that you would be mindful of that and have those conversations with your employees. The fabric face coverings, you know, uh, a good idea, for people out in public to be doing that. I've heard talk about, no shirt, no shoes, no mask, no service type of thing. That seems like it goes a little extreme. However, it does provide that protection for when we don't know if someone's asymptomatic and has the virus and could be potentially spreading it. Staying that 6 feet away, trying to maintain those distances for people and finding a way to do that within your stores and places of business. Minimizing congregating in groups of any size. So if you would see, there's been some guidance put out there about utilizing how many people you can have based on your square footage in the store, or how many people you can have based on your capacity and using a certain percentage of that. And be mindful of that, because that's trying to get those, being able to maintain that 6-foot guidance out there. And then just that, make sure employees are washing their hands frequently, make sure they're avoiding touching their face, and then wiping down the surfaces within your establishments. So I think that's those are kind of the points that Jen made in her deal today, and I'm just going to reinforce those.
Fantastic. Okay, we have a question.
Sure.
What is your recommendation for face coverings in an office setting?
Yep. So really the recommendation with face coverings is as you're coming in and out of the buildings, places where there's going to be potential for contacting other people. And then what we're utilizing at the health department is if you're within closer than 6 foot of somebody for longer than 5 minutes of time, then you would want to have a face covering on. Otherwise, if you come into an office and you're in a cubicle and you have kind of those dividers, or if you have actual office walls, once you get into your personal space and there's no interaction with other people at a close distance without some type of barrier in between, then you could have the face mask off.
Okay, and you did touch on this, the number of people in an office.
So the number of people in an office, again, it's what's needed to do your business operations, minimal is best. County is not opting to go back into the office setting at this point because of what we know about the science of the disease. We will continue to work remotely. And I realize not everybody can do that. We do have a minimal staff within our office building, and they are following those protocols. Again, I would look at your spacing and where people are sitting and that type of thing for those offices.
Okay, next question. Gym and yoga studio owner and health wellness guides put out by the WDC that say that they should have their employees and all members wear masks during workouts. That seems unsafe and unnecessary. Go ahead.
Yep. So I am just going to say that sometimes in those workout sessions, you are closer than that 6 foot, and most of those are for longer than 5 minutes of time. And then I realize that having a mask on can inhibit the way that you breathe, and what yoga is trying to focus on. So if there's a way to spread the people out and potentially not have those on, that would be a possibility. If they would have to be in close proximity, then we would still go with the recommendations from the reopening guides that do say to wear a mask during that.
Okay, next question. Oh, I should say, because you have a poll sitting in front of you. So
Yes.
I just did so that you know what you're looking at. I just did a quick poll. What does your company have planned for opening? And you can select from 3 options there. That would be great. And I will close that. I don't know if it's filling your entire screen, but I'll ask a question in the meantime. Can a church have worship using the person per square foot used in commercial?
Yep. So I would say if a church is looking at having services right now, we would really ask that they look at that latest guidance that came out with the square footage recommendations. If they're over a certain, I think, certain amount of square foot, they can use the square foot guidance to continue to have that 6 foot in between. Otherwise, if it's a smaller size area, not knowing which church is asking that question, then they would use a percentage of their capacity.
Okay, next question. Oh, poll did not include already open. That is a good one. Thank you. I'll take a look at that. I'm going to end the poll here so that you're not staring at that forever. We are, the next question, going to open May 26th. No reaction since last night's results. So any other questions out there? We tend to get really specific ones, as I'm sure you get, Carol, which is, I'm this type of business, how do I do that? I don't know. The latest one that I had before I came on here was salons. And so some of this is what can we expect? Because a lot of us are consumers. We're the public for a lot of businesses as well. So what do you recommend for salons? And then we go into the, let's start with salons. I'll take the complicated one next.
Yeah, there you go. Well, salons in themselves can be fairly complicated. So the nice part is WEDC did put some guidance together specific to salons. You know, so you need to think about how your salon is set up. And when we think about that fabric face covering, when I think about when I go to the salon, a lot of times my stylist is right in front of my face. And for protection of both, you know, we would ask that the stylist and the patron both be wearing masks during those times when there's going to be that close contact like that. And then where's the chair placement in the salons? You know, is there, are they sitting right next to each other, which wouldn't be recommended? I know in some salons, a lot of times they can have one chair. A lot of times they do every other chair type of thing, and maybe you have to implement something like that for a period of time just to get through this when we're still having cases of disease in our area. So those are probably my two biggest things, just the number of people coming in, chair placement, and then wearing the masks.
So the next complicated one is restaurants. So originally it was trying to distance the tables in there. And I think there's a bigger question in there, which is that the businesses are contemplating is there's a certain number of people you have to get in to be profitable. And so that's the conundrum, if you will, that businesses are up against is you need this many to be profitable, but the guideline really is right here. So what is your recommendation?
Yep. So I am going to bring up that separating the tables, so there is that 6 feet in between. You know, every other table, whatever that is. I realize that isn't ideal. So then, can you work with your municipality to utilize some spaces that you maybe haven't used before to be able to open up? You know, we've had some questions come into us about utilizing their parking lot spaces that are right next to the door. Can they fence that off and create an extra type of seating area, something to that effect? I realize that doesn't work for everybody either, because if there's no cover over those spaces, you are open to the elements then. So we would ask that you would follow the trying to distance in between tables as much as possible. And if you're not able to do that, you know, maybe focus on if tables have to sit close together, those are the people that are wearing the mask. Obviously, you can't wear a mask when you're eating, but, you know, just try and get creative with it. You know, I don't know if there's some way to put some type of barrier there, you know, some plexiglass barriers so that there's something protecting people in between the tables. I did see something, I think it was from Japan, where they had created plexiglass that went all the way around the chairs and the tables that they had installed in some of the eating facilities so that people could have tables right next to each other.
Okay, next question. How about screening clients that come in? Is that something they should be doing?
For certain types of services, I would say that's within your rights to be able to do, you know, that we want to, you're trying to run a business, you're trying to minimize the spread of disease. And that's one of the things that we know helps right now. You know, if you're just even just having them fill out a questionnaire. Have you had any of these things? It's in our toolkit. You know, have you had any of these symptoms in the last 14 days so that you can be mindful and try and prevent the spread of disease. That also is probably a legal question that they would have to run by their legal department, because some people may get in trouble for doing something like that. So I am not a lawyer. I do not offer legal advice. I just offer best solutions as I can.
And I'm going to encourage the people that are on the webinar here, if you want to go into the chat, there are businesses sharing some great best practices in there. So I'm not going to read those off, but certainly scan those when you get a chance. So salons that have spa components to them, what is your recommendation?
Yep. So I am anticipating right now, in between salon appointments or spa appointments, that they're doing a thorough job of cleaning and sanitizing in between. You just want to make sure that whatever cleaning or sanitizer you're using is effective at killing viruses, such as the COVID virus. And that, again, that you would leave enough time in between appointments so that as people come in, and leave, you have time in between to clean, so that you don't have to do it quickly, so you can really be methodical about that cleaning as you're doing it. And then again, not knowing how a lot of the salons or the spa services are, you wouldn't want close proximity between patrons and the people performing those services.
And I'm going to emphasize to everyone too, the county did put their statement out saying if we see a spike, there could be an order coming. The other piece we don't know is the governor and the legislators met this morning. They could put something in place again. It's expected that they would. So my only piece to all of you is that could throw a wrench in things, right? You get your restaurant fully stocked, you get your appointments fully booked, you get your customers coming, and another order comes down. So there is a question here about a second spike. So last I heard from Jen, she did not think that we had even gotten to past the first wave yet. But of course, we all want to think about second wave as well. So have you guys given that further conversation to say what happens if our numbers tick up? At what point does that become concerning? And then also, how do we know if there's a second wave and what happens?
Yep. So we have had a team working on our data piece and the metrics that involves. And part of that is that disease spike, which again, we're not sure we ever had a real first wave of a disease spike. You know, the disease just continued over the course of time. And the striking increase, you know, will be cause for alarm and will cause actions to be taken. We would use what metrics we currently have in place for determining that, and that would lead us to potentially write our own order, pending the state doesn't come out with anything else. If the state does come out with some orders and it is a blanket for the state, again, those are orders that we do have to enforce. So I like your cautioning everybody, you know, not knowing what's coming. Taking this step back and just looking through everything and seeing if you can reopen safely is a good protocol to take in place. But if the state doesn't put something out and we would see a spike in our area, which is what we would hope, the state would do a more regionalized approach, that if an area is seeing a spike, it gives them the capability to put processes in place where they could halt stuff from happening. We don't want to see that happen. You know, obviously we're concerned about our economy and everything too, but we also have to protect lives and public health based on the data and the way the disease moves. So.
And on that note, one of the criteria that we are really low on is the number of tests. And
Yep.
it was interesting when I looked at the numbers, because I think the goal was like 200, it was over 200 a day was the goal. And I will tell you, my reaction was, well, people aren't getting tested because they don't have symptoms. So so the only way to get to that number of tests would be to just have people go and get tested if they don't have symptoms. Is that the accurate interpretation of that?
That's a fairly accurate interpretation of that. Obviously, if we're only testing people that have symptoms, I know that having the testing event next week is going to help increase our testing numbers, and we are working with City of La Crosse as well as potentially having another second testing event if we're able to. That will help increase our numbers. We're also looking at having more people that are having types of procedures done. So we know some dentist offices are opening up, and that's, with the disease being spread from secretions from the mouth and nose, it would be wonderful if they were able to test everybody coming in for procedures at the dentist office. So there are some ways for us to increase our testing. The ones related to if they're having a procedure or if they're ill, those are happening mostly through our medical places. But we have weekly conversations with them to try and come up with ideas, so we'll come back with some ideas out of this today, just for ways for them to potentially increase that testing number.
I don't want to put you on the spot. I know that, is it May 21st at the Onalaska Omni Center?
Yep, May 21st, Onalaska Omni Center, and I'm not 100% certain on the time. I think it's 11 to 7, but again, not 100% certain. We're trying to capture both daytime workers, second shift workers. So they're starting it a little later and having it later into the day, I believe.
And this is the nasal test, correct?
This will be the nasal test,
Okay.
and then the National Guard will be coming in for this testing event. And there will be 4 lines that will be seeing people come through.
So if you, all 84 of you, want to go to the Omni Center, you can help get our numbers up. And I will tell you, my husband's had it done, and he said it's like they go up to your brain with that darn thing. So it's not pleasant, but you all can take one for the team and go show up for that. So, but that does help get our numbers up. And I'm guessing, Carol, the idea there is we don't know how prominent the virus is in our community until everyone is getting tested. And that will also pick up the people that are not displaying symptoms. Is that correct?
It should pick up some of those that are not displaying symptoms. That if you're asymptomatic but still are carrying it, it would be able to detect that.
Okay. And there was a question from Stephanie, and Carol, if you can reinforce what I think is the answer to this. So the question is, really, it's about the Badger bounce back plan, which was what the governor released. And now that businesses are open, my guess is going to be that if another order gets put in place, it's going to have to be in agreement with the legislature, and that's going to launch a whole other state level set of reopens. And so this gets interesting, right? Because we're open. And so if an order gets put in place, are they going to pull everybody back and then put certain people back out? Have you heard anything, Carol, from, sorry, you're coughing, sorry, I picked the wrong moment. So I haven't heard anything as to the next order coming through, because there's a lot of conversation that needs to happen between those two entities. Carol, have you heard anything about what would happen?
No, I have not. Agreed, there has to be a lot of communication between the legislature and the governor's office and Department of Health Services. I do know that the legislature was hoping for some type of regional approach, which would utilize the Badger Bounce Back Plan, so that in your area, if you're seeing all green lights, everything should be able to be open. In your area, if you're seeing some yellows and reds, you have to be at a different phase and kind of dial that knob back a little bit, and not have as many things open. The metric system that we're working on, if none of these things come back into play, kind of utilizes that system. And we've likened it to turning on a faucet, opening, closing, tightening. I like Badger Bounce Back, that's a ball going up and down, when we're up, it's good. And when it's down and we have to do some other things. So if we would see spikes in our area, and we would utilize something real similar to that Badger Bounce Back plan, that would be in essence turning a dial, to get activity down again. But from the state level, I don't know their plans.
If you have magical powers, Carol, and can send things up the communication channel, I think the piece that would be really helpful for our businesses is it's almost a prioritization, right? So when you tighten the faucet some more, who goes off is really important to know, and who goes on as it opens up. It's just really hard for our businesses to know where they are, quote unquote, in the open closed order. That would be really helpful. So all of these people have great questions. So one coming from Liz Filter at Bark. Can you confirm the health department's position on whether you're requiring anyone named as being in contact with the person who tested positive to quarantine for 2 weeks ago? Anyone named? Okay.
So probably it means if they've been identified as a contact of someone who has tested positive. So I do know in the algorithm that we use, if someone has tested positive and someone else has had close contact with them, that we would treat that person as positive until they either have a negative result or until they would have a negative result, or until they would go 2 weeks without having any symptoms. So if they haven't gotten tested themselves, then we would recommend that they do a 2-week quarantine.
Okay, there's a question here about trade schools. So salon trade school. They are following the salon guidelines. Is that the best approach, or should there be a different one?
That one is one that I'm going to say I don't have the answer to at this point, because that really falls into an area where we don't have as great of guidance on. Obviously, at times they're acting like a salon, and at times they're acting like a post-secondary school. And so we kind of have to weigh out all of those items as we make a decision and determination on that.
Okay. Miranda, I believe, is talking about an Alaska Omni Center test. The test that's coming to the community, will it detect if someone has already been exposed to the virus?
So this is not the antibody test. So it is just for if they have the disease right now.
Yeah, Miranda, there was a great webinar that we had yesterday with Mayo Clinic, their head of infectious disease, and she said there's a blood test for that one that detects that antibody. So Joe Heim, the info regarding the Omni Center, I should just type that in. It is May 21st from, I'm pretty sure it's 11 to 7 too, Carol.
Yep.
At the Omni Center. Type that in. Okay, other questions out there?
If we send all of our staff, do they get the sticker saying I was tested?
I like that idea. I'm sure I can have someone on our team make some of those up and they can come back. Oh, I can probably get some leftover I voted stickers and
there you
Right.
go.
those on them.
Yeah, that's exactly what I was thinking. Like, hey, we all got tested, helping out the number, so to speak. Carol, in all seriousness, though, obviously the concern for those of us who are open, now that everything is open, so to speak, is, where our staff are going when they're outside our four walls. Any tips or advice that we can communicate other than the norm to our staffers? I already sent out a huge email to mine saying, please adhere to the things outside my four walls, or as the same as what's in my four walls: masks, gloves, hand sanitizer, etc. I'm just real worried, some of them might make poor choices.
Yep, I can understand that and I can relate to that. I have a almost 30-year-old daughter that I've not been able to see since this started because she doesn't know how to social distance. And I've taken it very seriously. Obviously, working for public health, I've had to set an example and not have those connections outside of my house. And so, as short of getting, a survey out and saying, where have you been the last 24 hours before they come to work? I think just messaging, the importance of why you don't want them doing some of these things and what it means to your clients and customers and those types of things, I think is important for you to relay that message. Sorry, I don't have the magical answer for that one, Eve.
You're good. You're good. I mean, my message was in a lot of all caps. So,
yep.
you know, I'm hoping it was read very loud and clear. So yeah, it's a concern. And I think, you know, again, as people open up, you know, it's great to be open up. It's great to be getting our people paychecks and all that kind of stuff. But yeah, it's just a little concerning, you know, when you saw the news and there's people in the bar and doing things and
Mhm.
whatnot. So yeah.
Yep.
There's another piece of this too, which was in the recommendations from the county, and that is the special hours for people with that are higher risk. So, as everybody on the call and the webinar here think about reopening, certainly think about that as well. How can the people that have some of those higher risk qualities, how can they come in at a time and feel a little more protected? That's just a good, it's a good thing to do, but it's also a positive PR thing out there. But it also helps protect the vulnerable. On that note, Carol, one of the things that Governor Evers had spoken about was, okay, we've boxed everybody in and now we want to box the virus in, right? So we can let people out. How do we move forward better protecting those that are vulnerable, but also ensuring, again, that the virus gets boxed in?
Yep. So a lot of that comes down to communication about the disease and just letting people know when they have those symptoms to immediately halt, you know, any activities that they have felt free to go about and do. And then keeping them away from some of the higher risk areas, you know, as we open up businesses, you know, that's one thing, but, you know, it'd be nice if our long-term care facilities, which really is housing a population that could be sorely affected, and we've seen that happen in some areas, you know, if they can still keep some of those protocols in place. So it's one of those things, even though we've said, you know, uh, it's okay to open, but just because that's been said, it doesn't mean that you have to. You know, it's thinking about these things. Is, you know, where is the disease being seen? So boxing the disease in, if we're not boxing the people in and we're trying to box the disease in, that in essence is when people are sick. So those sick ones, we need to get them, you know, to stay home right away, get them into that isolation quarantine. And then we're trying to be quick about our responses as far as who they've had contact with. So, you know, within those, so we do that 2 days beforehand before they develop symptoms. And then we're contacting all of those people. And that's why you've seen the push from the state for contact tracers, because that's the piece of this that helps us, okay, I don't have symptoms yet, but I've been exposed. And so now I need to now go do this isolation and quarantine. So
There's a question here about, well, it's specifically about outdoor workout classes, but I think it could be applied to outdoors. So we know that the virus from Mayo yesterday, that this is very heavy. So it's in your saliva, it's very heavy. It doesn't tend to stay floating in the air. Does that change anything when people are interacting in an outdoor environment?
yep. So the nice part is it does sync or fast, which is nice. But that's part of the reason why we say that 6-foot distance, because that's what gives you that space for it to come out of your mouth and then get to the ground. So if you're doing some type of outdoor workout classes, you know, just putting those spacers in between, because again, as people are working out, you have the potential for secretions to come from your mouth and your nose, and we would just want to make sure that you're offering best protections. Same with walking out and about, you know. Again, we've been allowing that this whole time, but if you come into contact with somebody, you know, having that mask or, you know, maintaining your distance as you're trying to say hi to somebody in passing.
Okay, any other questions out there? I guess my last one for you is, so we're going to have a lot more businesses who have employees that they may send home because perhaps they have symptoms. I know originally you did not want to be asked for notes to go to the employers. Is that probably still going to be the case?
So notes to the employers if an employee's been sent home. We do have a blanket letter, you know, that we can send to somebody if an employer is requesting it. And typically we're only doing that if they are exhibiting symptoms. First and foremost though, typically we're telling them to go to their healthcare provider and try and either get tested or some type of statement from them. But knowing that isn't always going to happen, if they would call up and present and want something like that, we do have some staff that will send out a blanket letter to them.
Okay. There is another question. So they're getting sanitizing proposals for post-exposure employee infection and methods vary. Any recommendations on preferred technique for workplace sanitizing?
Good question, and actually one I should be able to answer really pretty off the top of my head. However, it has been a while since I've looked at the disinfection guidelines, and I apologize for that. We do have some recommendations on our website. We would recommend looking at the CDC guidelines as well. They've managed to keep up to date on their protocols. And it would be one of those things, I'm just going to talk about, you know, your high traffic areas where you would have a lot of different people touching stuff and potential for things to be happening, and making sure that you're wiping down those areas fairly routinely. We're going to have some new types of places that are open that haven't been opened, and just think about what you need to be cleaning and sanitizing in between. Restaurants allowing sit down dining now, you're going to have those table surfaces which have been, you know, cleaned in the past, but you know, you're going to want to do that soap and water cleaning and then come behind with some type of sanitizer to remove as much as possible of any type of contamination.
We did have a webinar too, Paul, on, it was with Schilling Supply, and one of the pieces that they shared too is you really have to read the bottle of the cleaners that you're using, because they all have a time that they need to sit to properly sanitize. So if you're wiping that away too quickly, you're not really getting the full effects of the sanitizer. And so if you go to our chamber website to where the webinars are, you can replay that webinar. It was interesting. Yeah. Al, you have a question? You're muted. There you go.
Okay. So I have a question. In our industry, because we're high risk for robbery, nationwide, what they're recommending for us to do, and my question is, what are banks planning on doing with people coming in with masks on? They're saying that we should require masks to be lowered so we can get it on video, and people have to show their picture ID so it's on video. I think it's gonna make people pretty uncomfortable, but it's pretty an unsafe environment for what we do. Is there any recommendations?
That's a good question. I think and I don't know if it was you, but I know we had communications with one bank about the lowering of the mask as they come in. I think showing the picture ID at the same time that they do that is a good idea. And then you know, trying to get as many people as possible to utilize your drive-through services, but obviously I know for safe deposit boxes or, you know, doing some of the loan stuff that you might have to do, that's not an option. And I'm not really sure what other guidance is out there for banks. Obviously, I can understand the concern with people coming into the banks with masks on, because that's been frowned upon for over 200 years. So I wish I had more guidance for you on that. But at present point in time, that's about all I know. We did consult with the local law enforcement to see if they had anything else that they could offer when we were asked that question. I did not see any response from them at that time.
If I had to guess, Al, I know you're a jewelry store. If I had to guess, the banks are just going to hold off on having people come into the lobby because they can do drive-through and whatnot. So, and they've adapted. But I can get you an answer to that. I know you're a little different because people can't drive through and get their jewelry, right? So,
no.
Yeah, although that'd be interesting, but so yeah, you have a pretty specific one. And usually what I recommend is there's associations for every industry out there. And so if there's a national association that you can rely on, my guess is they might have had some guidelines out there.
That's what ours recommended.
Yeah. Okay, any other questions here? There are none. So with that, thank you all for coming on. I know, just an FYI, that Ron Kind has a 4 o'clock here. We put some information in our e-newsletter. So if you want to get a little bit of Ron Kind, he's coming up. I think they have a vote on Friday. They're trying to rally, which is tomorrow. They're trying to rally a vote at the federal level for the next stimulus package at the federal level. So thank you, Carol, for all of your hard work. It's been a rough 2 months for you, I know, the whole department, and but we greatly appreciate your guidance and being there to answer all of the many questions, and know that you guys are doing what you can to protect us. So thank you so very much for coming on.
Thank you for having me. We will see you later.
Sounds good. Bye, everybody.
Bye.
Carol.